everyone. Dr. Gama Bandawe here. Today we're continuing from the topic that we started last week. A lot of you had a lot of questions around what happens when people are getting repeat positive COVID tests, and a lot of questions around infectivity. So I thought it would be great. We're starting a new format this year in terms of engaging not only myself but actual other experts locally, because we have a lot of medical experts in the field, a lot of other experts as well. So this week we have Dr. Gama Bandawe, a medical virologist from MUST. He will explain to us what exactly medical virology is, but he's going to take us through this discussion around the testing, the effectivity, and all of that. Welcome, Dr. Gama.
Thank you. Thank you so much.
Tell us, because we said medical virology, which is so technical, what exactly is medical virology?
Okay, so it's a branch of virology. Virology is a study of viruses, and viruses infect everything.
Yes.
Everything.
Yeah.
They have computers too.
Yeah, true.
So every single living type of living organism that there is can be infected by viruses. That includes bacteria and everything else.
Yes.
So medical virology is the study of viruses that are important for our public health, that are important for medical.
Great. And obviously we know COVID-19 is a virus, so this is basically your special, like this is your thing.
Yeah, well, sort of.
Okay, so tell us, now that we understand medical virology, and obviously I think that COVID-19 being a virus, you have been following the trend and all of this has been happening with this virus. And one of the questions I was sharing was that last week I had done a video talking about, people who are staying positive a long time and so forth, but maybe we had a discussion as well in terms of just all the factors that are influencing that, and I thought it would be helpful to discuss with the public as well. So let's start from the beginning. When someone gets COVID-19, they just want to know how long will I be infected? Because I think we get people isolated and everything like that. What are the studies locally and globally saying about when someone has COVID-19, how long are they infected?
Okay, so locally it's a bit difficult to say, to study all of those steps proves a bit tricky, but there are a lot of studies being done internationally. Actually, I'm very excited because in the last week, we've just seen the results of the first human challenge studies.
Okay.
All right, so this is now people who actually get volunteers and they deliberately infect them.
Wow. Okay.
And if you infect somebody deliberately, you know exactly how much virus you give them, and then you can test them every hour, and you can see exactly what goes on. And some really nice stuff is coming out. So one of the first things that we're realizing from these human challenge studies is that the incubation period is a lot shorter than we thought.
Okay.
Before we talk about 7, sometimes 21 days, etc. But basically everybody who got infected with human challenge studies within 48 hours, within 2 or 3 days, everybody had an established infection. Okay. So the infection it picks up pretty quickly.
Okay. And was this with the Omicron or was it what variant?
No, I think they used mainly Delta.
Okay, fine. It was Delta, which was okay. So that's interesting. Okay.
So within 48 hours, you pretty much have an established infection. So that's the first thing. The other thing that we know from this and from other studies is that you are really very infectious very early in the course of infection. And it's the same with many viruses. With HIV, when you just get infected, you're most infectious. And it's the same thing, because what happens is that you've got lots of particle cells in the production, it's just through the roof.
So it's a child in a candy store.
Yes, so it's free.
So
it's exactly the same thing. And then actually, so if you take the concept of symptoms at day 0, you're actually really infectious from day -2 until about day +2 or +3.
So around that.
So around the time when you just before the day or two before you're really feeling symptoms, and then the day or two after, that's when you're the most infectious.
Okay. So and being infectious, I think just for people to understand, is the time that you're most likely to transmit to others. So what we're saying here, if I'm understanding correctly, is that for someone who gets COVID, they're most infectious 2 days before they have any symptoms, if they get any symptoms at all, and around and the 2 days after. So if you're starting to feel a little bit of a cough and whatever, that's the time that you're most likely. So you should be really doing a lot more to protect yourself and others around you at that period.
That's exactly it. And the way that they study these things, what they do is that they'll take a swab. And then, so there are all these tests, the antigen tests, the PCR test, which I know we're going to get into that. But what they do is when they take the swab, the test for infectivity, what they do is they don't rely on just the fact that there's antigen or the fact that there's this, nucleic acid. They actually take them into the lab and see if they can cause an infection in cells in the lab. So a lot of times, and these are the things that we're discussing, you can be having either the RNA, or you can be having some antigen floating around. It doesn't necessarily mean that you are infectious, or that those bits of virus that there are going to cause a new infection.
And so I think this sort of relates to that issue we're talking about, how people can continuously get positive tests. I think we will discuss it a bit later in terms of how does that then influence everything else. So we're hearing this, that people are sort of infected around that period, that short 5-day period, 2 days before, 2 days after symptoms. What's the influence of having vaccination, like COVID vaccines? Because I think there's a lot of thoughts around, I think we're just trying to understand COVID vaccines. We know that the real benefit is reducing, sort of death, preventing death or severe illness. Is there any impact of COVID vaccination on how effective somebody can be?
Yes, there absolutely is. And it's really important as well. What's important to remember is that you're infectious quite early on. The time it takes for you to clear the virus determines how many days you remain infectious for.
That makes sense.
And so obviously, if you're infectious for 10 days, you will just meet more people in 10 days than you would in 5 days. And so vaccination status plays a role in that. If you are vaccinated, it means that you've already got antibodies floating in your system. It means that as soon as the virus comes in, it's already under pressure. What happens early on is that it kind of overwhelms the antibodies. But if you're unvaccinated, your body is now going to start figuring the whole thing from scratch. Okay, all right. Okay, here's this antigen. Go through the whole system, and and it takes a while. If you are vaccinated, you already have antibodies floating around. You also have cells that are kind of ready to ramp up production of those antibodies. And so it's a very, very quick switch. So once the virus comes in, even though it kind of takes off and really gets a head start, which is why, this whole issue about, I'm vaccinated, but I'm still infectious, So that's the case very briefly, just because, the virus gets a really quick start. If you're vaccinated, your body also gets a very quick response. And so you'll be able to start to clear the virus just a lot quicker. And in the one study, for example, they found that it took on average 5 days for unvaccinated people to clear the virus. It took 3 days for people who were vaccinated to clear the virus. And so you are infectious for a shorter period of time, you clear the virus faster, and that's the influence of staying vaccinated. And basically the peak viremia initially might be similar, but it's much briefer.
And you said viremia, which I know a lot of people won't understand. So it's the amount of virus in your body.
Virus that you have in your body.
And so those who are just picking in and joining in, we're listening and talking to Dr. Gama Bandawe, medical virologist, studies viruses, guys. So really is an expert in understanding COVID, which is a virus. So hopefully we were just talking about how long somebody can stay infectious. We've talked about sort of generally, and also the vaccination status, which my understanding from you is that if somebody has a vaccination, has been fully vaccinated, hopefully not just partially and just got one step, but fully vaccinated, that has an influence in reducing how long you can be infectious. So it's sort of like a relay that the virus might get started, but you can catch up pretty quickly.
Up very quick.
And respond. That's great to know. So this is interesting because I think most people listening into us today are just thinking, well, that's fine. If I get a cough today, I get a COVID test tomorrow, I'm going to be clear by 2 days' time, I can get back to work. What are the other factors we need to consider before people sort of go happily all the way? If they got a COVID test or get, sort of COVID, what are other factors apart from vaccination status that influence how long somebody can stay infectious?
There's a whole bunch of things, but I think some of the most important ones are how bad the infection is. If you get a severe infection and you're really sick, often it means that you take a little longer. And this kind of relates also quite likely to the infectious dose that you get. If you get a huge amount of virus, and so this is why wearing masks and all these other factors are really important, because you might still get it, but if you get a few, you give your body a chance, a fighting chance. If somebody, basically spits in your mouth,
throws in the COVID.
You know,
yes.
It really sets you back because just the infectious dose is really huge. And then there are other sort of genetic factors, to see, some people just mount a better response than others. But basically, if you get a much more severe case, you're more likely to be infectious, more infectious, and for longer.
Okay, so that's helpful because I think what we're hearing from all of this is that all these preventive measures have a role to play, right?
Yes,
because
they do.
Even if you do get an infection, it sounds like if you wear your mask, you probably get a lesser dose, so you get a lesser infection, you're less infectious. If you're vaccinated, again, even if you get infected.
As well.
So preventive measures work, guys. We're not just chanting randomly. The science and all the data that's coming out is actually promoting that. So let's reel in, because the real thing that people want to know is, when can I get out? Because I think people are trying to understand, like, how long should I stay? What should we do? What's the current guidelines in Malawi? Like, what is, I think we were talking through, as we were discussing, what is currently Malawi's stance in terms of, if I get COVID, how long should I isolate? Because that's the guidance now.
Okay. Well, essentially, we're basically at 10 days.
Yeah.
Right. So if you get an infection, whether it's symptomatic or asymptomatic, you should isolate for a minimum of 10 days.
Yeah.
So let's say you're not symptomatic.
Yeah.
You want to travel.
Yeah.
And you get a positive test. Then basically the guideline is that just take the next 10 days.
Yeah.
What's important coming to the end of that 10 days is that you should have at least 3 days where you don't have any symptoms.
Yeah.
So obviously, if you weren't symptomatic in the first place, you'll basically just wait the 10 days.
Yeah.
If you are feeling a bit sick and you're not so well, give yourself 10 days, but those last 3 days should be without any symptoms.
Sure.
And once you've had 3 symptom-free days, and at a minimum of 10 days, then basically you're good to come back. Now, what's important is that we are not saying, so the guidance is based on 2 things, on time and your symptoms.
Yes.
We, as a country, are basically taking the position that we are not sure about giving everybody a second test to come back. And there are many reasons why the policy and the guidelines go like that.
Availability and all of that.
Follow-up tests. We want to make sure that, people are getting that first test so that they can do infection prevention. And also, I think at the time, it was mainly PCR. We've now got antigen tests now, and then the issues around how sensitive the antigen test is and all of that. So this is a kind of basic guideline which is really helpful. It's good. But now everyone is changing.
Yeah.
So when you're drawing up these sorts of guidelines, what you're trying to do is you're trying to balance between keeping everybody safe.
Sure.
But also trying to minimize the disruption.
Yeah.
So one of the things that happened now with the Omicron wave, for example, is that in some hospitals, 60, sometimes 80% of the staff will have to be booked off because this thing was spreading so fast.
Departments couldn't, there were departments that had no staff. The nurses, the doctors, everyone was gone. Health centers sometimes, I think before, were actually closing.
Yes, and which is terrible.
Yeah.
I mean, it disrupts all sorts of services. So, the guidelines were kind of there to help us balance, and a lot of the changes that we're seeing in the guidelines are also, especially internationally. In Malawi, we haven't changed yet, although we're thinking about, we're discussing that. But a lot of the changes that we're seeing are basically where people are weighing up the economic options, how disruptive it is, and so in the UK, they cut down to 7 days from 10.
Yeah.
In the US, they cut down to 5 days.
Sure.
And this is just to try and keep the economy ticking over. But the bottom line is this: that you as a country have to accept what level of risk, or you have to understand or
understand your context, your landscape.
What's an acceptable level of risk for you? And in some places, where they cut down to 5 days, people were criticized. Say, look, this is crazy.
CDC's crazy.
What's
happening? Yeah.
But in the UK, I think they went down to 7. And then down to 5 as well. And I think basically governments and everyone is just trying to get to that stage where the amount of disruption that is causing is should be reduced. But there's also a context there, because in many of those settings there are high levels of vaccination.
Yes.
And so people are highly vaccinated.
They're not going to be as infectious
they're not going to be as infectious and things like that. Although, having said that, now when you look at Malawi, there are very high levels of prior exposure.
Yes. I've-
You know,
that's-
so
that's-
so this is the paper that we
Yeah.
were all talking about, Conrad Njambo's paper,
Yeah.
which was a shock to many people,
Sure.
but it really has us thinking about, okay, since most people have been exposed at some point, you know, what's an acceptable level of risk?
Yeah.
But now it's tricky because having prior exposure means that you could have been exposed 2 or 3 waves ago.
Yeah, and now you've lost your
Now your
immunity,
is faded. You know, and then there could be a completely different variant that behaves differently. So while it's important to see and understand that a lot of people have been affected,
Yeah.
it's really up to us to kind of understand what that means, you know, in terms of these restrictions.
So currently, and so you just sort of reeling that all in. Currently, Malawi is basing, like, if I was tested positive for COVID, I just wait my 10 days. If I had no symptoms, especially the last 3 days, I can get out.
That's it.
And you know, because we were discussing this, especially in terms of people, because I think that's what the video I did last time was like. Well, some people are requiring tests. Is there no, because I think people are also critical of like, should we just trust somebody saying come back without retesting?
Right.
Is there a need for retesting at all? I mean, if all, you know, because I think on a public scale it might be challenging, but like I've seen organizations and others require that, and that's why we're getting all these people with repeat positive tests. Would you say it's not really necessary at all, especially looking at all these factors that we're saying that somebody, you know, is probably infectious first 5 days, if they finish their 10 days.
Well, look, this is my personal view.
Yes,
you know, I think there's some benefit to testing because, you know, a lot of this is about when you go back to work, you want to feel safe.
Yes.
And if you know that, okay, everyone who's back here has either isolated sufficiently, has had a test to come back, I think that's an important thing. It provides that important level of comfort. And you know, organizations also don't want to open themselves up to get sued.
Risk
And,
and liable, especially schools.
Yeah, you want to provide an unsafe environment
yes.
where you knew that people could get infected.
Sure.
So I think there's some value, but in testing to come back. But I think as a national strategy for us to agree that that's not the main thing that we'll do, I think that's okay.
Yeah.
For organizations who do want to test people, you know, to end isolation, to discharge from isolation, I think we need to think very carefully about what test we're doing.
Sure.
The PCR test, I think, is tricky. I think it's very tricky because it's almost too sensitive.
Yes.
Because what happens is that you are infectious for a certain period of time. After some time, you will still have bits of virus floating around. You'll have virus debris. Your body's been breaking it down. Things like PCR will continue to pick that up.
Yes, that's
for
why,
a long time.
That's why people continue to have positive for forever.
And then, you know, you can get into CT values, and those can be quite informative. You know, if their CT value is sort of above 25, in general, those swabs that I spoke about earlier on will struggle to start infections. You know, in experimental cells or whatever. So if someone's CT value is above 25, usually you can kind of say maybe you're not infectious, etc. But different platforms have different cutoffs and different CT values, so it gets kind of messy when you're trying to think about that. Now, it turns out that the rapid antigen tests are pretty good at figuring out when a person is actually infectious. When you actually have infectious virus, because it tracks that very nicely. The big problem though with that is that very early on, it doesn't pick up as well as it should, and towards the end, maybe the sensitivity falls off a little bit. But in general, a rapid antigen test is really good at telling you, you know, if you're infectious or not. So if you really want, you know, a way to kind of gauge if somebody's infectious, that's a good way to do that. Of course, understanding that there are caveats
and all that. So basically, I mean, as sort of to summarize all of that, Malawi is using symptom-based. If you're in isolation, you've finished your 10 days, you're good to go, you can come back. If you're an organization, school that really wants to have something documented, you could aim for, you know, the PCR has its issues because people keep getting positive tests and all of that. The CT value is tricky, but it might be helpful. Potentially the antigen test, if you get somebody to get a antigen test, if it's negative, you're happy.
You can be quite comfortable.
You can be quite comfortable. If it's still positive, then you...
No, so if your antigen test is coming back positive, then you really want to continue isolation.
Okay.
Because, you know, it picks up on active virus that's
Yeah,
happening,
okay.
and it's not going to pick up on bits of RNA and other things. It'll pick up maybe the proteins if they're hanging around a little bit, but in general, it's a pretty good prognostic of how infectious you are.
Sure.
Yeah.
Thank you so much. I mean, this has been very helpful. Maybe in terms of rounding it all off, we understand what would be sort of your recommendations. We've talked through how long people stay infectious. We've talked through the testing and all this testing. We've talked to what Malawi is doing now. We've heard, and I think you discussed that a little bit in detail about the fact that other countries have reduced. If we're recommending something to the government of Malawi, like what in your expertise, and I know there's a lot of factors to play here, we know Malawi has a very low vaccination status, but we also know, because one of the studies has shown that a lot of people probably have been exposed to COVID, didn't even know, probably asymptomatic, and then we know how long people stay infectious, and we know the testing and all of that. What, if we put it all together in your expertise, just to round it off for people who are listening, what would be, sort of your recommendations? Yeah.
Okay. Well, look, I agree that I think one of the things that we've really learned over the last couple of years is how disruptive economically and to education and everything else. So I really understand and I appreciate people like Dr. Gama and others who really, and yourself, who really highlighted how disruptive this thing has been, and we've got to think very carefully when we restrict people.
Yes.
So the recommendations is currently at 10 days. I would suggest that we also move in a downward direction.
Sure.
I would suggest that we put it, say, at about 7 days.
Sure.
What I would also suggest is that if we know people have been fully vaccinated,
Sure.
then it should be even less than that.
Sure.
So I would say, about 7 days for everybody. If you have been fully vaccinated, then you should probably isolate for about 5 days.
Okay.
I think it'll also encourage people to get vaccinated.
Unless I'm a lazy worker and don't want to go back to work, but sure, that would make sense. Okay.
And then in general, I think I would, especially because of just access,
Sure.
I would stick to just having a time and a symptom-based
Sure.
discharge criteria.
No need for testing.
Yeah, look, for those, especially for organizations, private companies and others who can afford
Sure.
to get that, that's fine. I think that's good. And even in that case, I would suggest that
Just
the
the
rapid antigen,
Yeah.
go with that. But for everybody else, I think we'll just say, look, 7 days if you're not vaccinated, 5 days if you are either fully vaccinated or completely asymptomatic.
Sure.
Then I think 5 days would be good. That would be kind of the recommendations that
you would
I would
suggest.
go with. And who knows? Maybe things could happen in that.
Great. Thank you so much for coming through. I know it's a busy time for you, but we really appreciate your expertise. This is great. Guys, this is Dr. Gama Bandawe, medical virologist and expert in viruses, explaining to us various things that's happening in terms of how long COVID stays infectious, what is happening with testing and sort of isolation, and giving his recommendations, which, although the Ministry of Health has not changed the guidelines, these are some of the factors that we could put in place. So if yourself as an organization or anybody is thinking through and trying to understand how to layer all these factors, these are some of the things that you could be putting on in place. And again, just consider getting credible information from reliable sources like our experts here from MUST. So thank you so much and have a good day.
Thank you.
Thanks.
Thank you so much.